Hi, Mr. Red, it's Dave, student nurse again. The doctor ordered an NG tube. There's some blockage, so we want to get a tube. We're going to insert it into your nose, down into your stomach. Can I just get your name and date of birth, please? Great. And do you have any allergies? No? Good. Checking to confirm. Okay, what I'm going to do is I'm going to get prepared for the procedure. Do you have any questions before we begin? When was the last time you had something to eat or drink? Okay, good. Okay, we're gonna put your head up, high Fowler position. You feel okay? Okay, good. Just gonna bring your blanket down. I'm gonna get all my materials first. I'm gonna wash my hands. Hand hygiene. Get some gloves. They are the tiniest of gloves. Small, large. It's the problem I always have, trying to find the large gloves. So do you have any questions before we begin? There'll be some discomfort, but there won't be any pain, and we'll be as careful as we can, okay? All right, good. The first thing I'm going to do is I'm going to put an emesis basin here. In case you do feel nauseous at all, that's there for you. I have a glass of water. I'm also going to get my tape ready so we can secure it once we have it in place. I'm going to bring Chuck over. I'm just going to have this right on your lap here. Is that okay? And we have the NG tube as well. All right, we're going to begin, okay? All right, good. I'm going to open it up and maintain cleanliness as we begin. I'm just going to put this right here. First thing I'm going to do is I'm going to measure it, okay? So the way that we do that is I'm going to measure from your nose to your earlobe. I'm going to just bring your gown down, and I'm going to check the xiphoid process, okay? Now before we do that, I do want to make sure, checking up your nose that there's no blockage, no deviated septum. Can you do me a favor? Take a deep breath, breathe out, good. Deep breath, breathe out, good. Did you feel any blockage or anything? No, I think we're clear. Okay, good. So we do have the NG tube. What I'm going to do is again measure from the nose to the earlobe to the xiphoid process. Have a piece of tape here. I'm going to wrap around so that we know that we're all the way in. Next I'm going to do is get some lubrication, 3 inches worth of lubrication, okay? And we're going to insert it into your left nostril, all right? Now, what I'm going to ask you to do, I'm going to insert it a little bit, and you might feel some resistance. I'm going to have the water here for you to take some sips, okay? So what I'm going to do, we're going to begin. I'm going to go straight back towards the ear to advance the catheter. Keep advancing, keep advancing. In the nasopharynx, I have some coughing, so I'm going to ask you if you would tilt your head forward, have your water here, take some sips, sip, sip, sip. And advance it further. Good. It's in place. So what I'm going to do now is I'm going to tape it in place so that we're going to not get any more movement while holding it here. You doing okay? You tolerated that well. The worst of it is over. Take that in place there. There you go. Okay, good. Now what I'm going to do, I'm going to drop some of the contents here. Drop just a little bit. Just squirt it out. Put it under 4. Next thing I'm going to do is I'm going to insert about 10 to 20 mLs. And first I'm gonna just listen to see if we're in place. Just above the umbilicus. And I do hear a whoosh of the air going in, so that's good. Shows me it's a good place. So that's 2 of the parameters. So we've checked the pH, and we've also checked to hear the whoosh for auscultation. I'm gonna remove this. And what I will also do before any medications is we would also see if the doctor would award an x-ray for us. So I'm gonna bring up your gown. I'm going to make sure that I put the tube, adhere it to your gown. Make sure that when you are changing your gown or anything, you don't tug on this. You don't want this to come out again, okay? I'm gonna clean up the area, tolerated it very well. Sorry if it did hurt a little bit. Move this out of the way. Make sure you're comfortable. I'm gonna wash my hands, document the procedure that I was in the left nostril. Patient handled it or tolerated it well, and ask the doctor for an x-ray to confirm. That concludes. If you have any questions for me, please let me know. Thank you.